So welcome to this module on vascular surgery. My name is Aidan Moore. I'm one of the foundation doctors working in Cardiff and Vale this year. And this module has been produced in collaboration with one of the fourth year medical students, Mr. Harry Smith. So the first thing to address really is why we decided to make this module. When I was working on the vascular ward in the Heath, we had some medical students on the ward, and the general consensus from them was that vascular surgery was a topic that wasn't covered well in the curriculum and that they didn't know a great deal about. So I didn't train in Cardiff, I trained in Manchester, but the general theme or feedback of vascular surgery was quite similar at my university. So with that in mind, I thought that we'd try and address the gap in knowledge and improve people's experience of vascular surgery. So we sent out a survey to find out what people's current knowledge was and what people's current feelings towards vascular surgery were. And the replies reflected back that about 90% of you felt unprepared to undertake a job in vascular surgery and underprepared to do examinations or answer questions on the topic, which is a sizable proportion of the year. So with that in mind, we decided to make some lectures and to cover different areas of vascular surgery so that you guys get a good overview of the topics and a better understanding of what actually vascular surgery is. So in terms of the general vascular patient, I think that they're particularly interesting. They have a lot of comorbidities and their medical care becomes quite complex. We tend to find that these patients have generalized arterial disease stemming from atherosclerosis, so fatty deposits and narrowing of the arteries. And it's often these things that develop other comorbidities. So they end up with hypertension, end up with coronary artery disease, end up with renal disease, can end up with diabetes. On top of that, they also may have cardiac issues, neurological issues. And essentially, it's the mix of these comorbidities as they progress and become advanced and end stage that creates a lot of the vascular problems that require surgery. So these patients are quite interesting from both a medical point of view and a surgical point of view. Within the content of this module, we've made 5 lectures for you to go through. So within arterial disease, we're going to look at the general process of arterial disease, so atherosclerosis and hypertension, and then we'll also look at some of the vascular interventions that can be done and some of the indications for those, like arterial bypass grafts and the management of things like necrosis and gangrene. Abdominal aortic aneurysms has its own lecture because it's a very diverse and interesting topic, and as well as looking at the screening processes and the anatomy involved in aneurysms, we'll also look at the surgical interventions. Within venous disease, we're going to look at a bit more about the pathophysiology of chronic venous insufficiency and how it occurs, as well as the complications of varicose veins and the management of that. And within that, we'll also discuss the different kinds of ulcers that can crop up in patients. Vascular pharmacology takes a deeper look at things like antiplatelets and anticoagulants, and it also looks at this general term that gets thrown around in vascular surgery of best medical management and what that actually involves. The last lecture is a relatively short one, all about lymphatic disease, specifically about lymphedema, which is a topic that tends to be undercovered or underutilized in most curriculums. And to tie all of those questions together and give you guys a chance to put your knowledge into action, we've made about 60 multiple choice questions that cover content in the lectures and then a few more general medical topics that will just push your learning further and challenge you. And all the questions have explained answers to give you a feel of why the situation works in the way that it does, essentially. Ultimately, we hope that you learn a lot about vascular surgery and vascular topics and that you take away a lot from this module. Ultimately, this is the first time that Cardiff and Vale has done an online learning module of this kind with lectures, questions, and a chance to give feedback. So if you really enjoy it and you feel that you've gotten a lot out of it, we'd really love that feedback so that we can progress and maybe do more things, not just with vascular surgery, but with other specialties that you feel maybe underutilized in your medical school curriculum. Similarly, if you go through the lectures and you find that there are certain topics that are not covered in as much depth as you would like, or that things are, you don't understand something as well. And please feed that back as well. We can always edit and tweak the lectures so that you guys get as much from them as you can do. So with that being said, I hope you're able to crack on with the modules and learn a lot.